Now today's presentation is part 2 of nursing practice questions and answers about fluids and electrolytes. Now let's start with the first question. The nurse is assessing a client with a lactose intolerance disorder for a suspected diagnosis of hypocalcemia. Which clinical manifestation would the nurse expect to note in the client? So these are the options. Option A, twitching. Option B, hypoactive bowel sounds. Option C, negative trouser sign. Option D, hypoactive deep tendon reflexes. So the correct answer for this question is option A, twitching. Now let's move to the rationale. A client with lactose intolerance is at risk for developing hypocalcemia because food products that contain calcium also contain lactose. The normal serum calcium level is 9 to 10.5 mg per deciliter. A serum calcium level lower than 9 mg per deciliter indicates hypocalcemia. Signs of hypocalcemia include paresthesias, followed by numbness and a positive trouser sign. Additional signs of hypocalcemia include increased neuromuscular excitability, muscle cramps, twitching, tetany, seizures, irritability, and anxiety. Gastrointestinal symptoms include increased gastric motility, hyperactive bowel sounds, abdominal cramping, and diarrhea. Now let's move to the second question. The nurse is caring for a client with Crohn's disease who has a calcium level of 8 mg per deciliter. Which patterns would the nurse watch for on the electrocardiogram? So select all that apply. Option A, peaked T waves. Option B, widened T wave. Option C, prominent U wave. Option D, prolonged QT interval. Option E, prolonged ST segment. So the correct answer for this question is options D, prolonged QT interval, and option E, prolonged ST segment. Now let's move to the rationale. A client with Crohn's disease is at risk for hypocalcemia. The normal serum calcium level is 9 to 10.5 mg per deciliter. A serum calcium level lower than 9 mg per deciliter indicates hypocalcemia. Electrocardiographic changes that occur in a client with hypocalcemia include a prolonged QT interval and prolonged ST segment. Peaked T waves occur with myocardial infarction. A shortened ST segment and a widened T wave occur with hypercalcemia. Finally, ST depression and prominent U waves occur with hypokalemia. Thank you for watching.